Today we are going to discuss about nursing assessment. I think the first and second part of nursing assessment have been done. Okay, this is part 3. These are learning outcomes according to your learning guide. These are the learning outcomes. State 2 components of psychosocial assessments, because this part is mainly about psychosocial assessment. Okay, I think physical assessment has been done. The second outcome is differentiate between the elements of interpersonal and intrapersonal and interpersonal assessment, explain how to conduct psychosocial assessment, highlight 2 possible nursing diagnoses on spiritual assessment. These are learning outcomes. Can you all see the screen? If no, you can move to this side. Is it okay? According to those outcomes, this is the content. We are going to discuss about psychosocial assessment, elements of intrapersonal and interpersonal assessment, how to conduct psychosocial assessment, spiritual assessment, and nursing diagnosis on spiritual assessment. This is the content. What is psychosocial assessment? There are, when we talk about psychosocial assessment, there are two main components. Okay, one is intrapersonal assessment and interpersonal assessment. Intrapersonal assessment means behavior refers to an individual inner being. What we can, or what the patient can feel about his or her own inner feelings. Okay, and interpersonal assessment is individuals' interactions with others. Interactions with others means emotionally, not people to people. We will talk about it in detail. These are the elements of psychosocial assessment according to what we have discussed. Mainly there are two, intrapersonal and interpersonal. Under interpersonal assessment, you can think about the patient's self-concept. What is self-concept? Self-concept. Is it important to know about self-concept? Why? Can one of you give me any idea regarding that? Why it is important to know about patient's self-concept? Any simple idea? Why we should learn that? Self-concept. Do you have idea? I think you all have some idea on that. Can you tell me? Ourselves. Any idea? Which kind of, she is telling to avoid some problems, we need to learn about self-concept. Which kind of problem? Communication barriers. Have you or do you have any experience on giving medication? Yes. Then when giving medication when we talk about the compliance of medication, self-concept is very important. Why? Why? To identify. Yeah. In one way, it is to identify the patient. And what is the importance of knowing about self-concept? If I am telling like that, if patient refuses medication, what are the reasons? Maybe the patient thinks, I will not get any cure because of this medication. That is his self-concept. Yeah, maybe patient will tell, according to my experience, with these medications or with these capsules, with these tablets, I will not get any relief. So that I don't like to have this medication. That is the patient's self-concept about medication. Then what will happen? Or patient will tell, with any kind of medication, this my disease condition will not get cured. That is his another kind of self-concept. With the medication, the patient is telling, with the medication, no cure. That is his self-concept. Then what is the importance of knowing about that? If patient's self-concept is that, how can you convince to have medication? Even though you are forcing to have medication or give medication, is it effective? No. Why? The patient self-concept is that. That's like patient's attitudes towards that maybe his disease condition or towards that particular procedure. So that knowing about or assessing the patient's self-concept is very important. Because we have to, if we assess that self-concept of patient, we can identify the patient's situation on taking medication, on the patient's disease condition. We can identify the patient. So that knowing about self-concept is very important. Then what you can do is, you can give health education to change the patient's self-concept, to change the patient's attitudes. Then only you can convince him to have medication. Okay? And cognition. Patient's cognition. Cognition is related to what? Related to knowledge. Very good. Cognitions means like intellectual ability of the patient. If we know that, if we can identify the patient's intellectual ability or the cognition, that means we can identify the patient's situation or patient's status of understanding what we are saying about the disease condition or what we are going to do for the patient's relief. And affect, what do you mean by affect? When normally you are learning, just before 1 year you learn in the classroom. As you all know, there are 3 domains of learning. Do you know that? Cognitive domain, psychomotor domain, and the other one is, you all know that, affective domain. Have you heard? Those are the, no, I am going to give you some simple idea to identify what is affect. Now, as you all know, cognition or cognitive means intellectual skills. Intellectual skills means when the word is there, you can identify intellectual. It's related to knowledge. And affective means, psychomotor means psychomotor, related to skills. Psychomotor, whether they can do something. Psychomotor ability, whether they can do something. Affective means related to attitudes. Now can you keep in your mind what is affect? Affect means related to attitudes. So that we should know when assessing the patient's intrapersonal assessment, affective domain is very important. Patient's attitudes, cognition and self-concept. And temperament means like temper, out of temper, like when you are get angry, their emotions, how the patient can tolerate those things. And interpersonal assessment, under that you can assess patient's communication pattern. In which pattern patient likes to communicate with the others or with the healthcare team. And roles and relationships. Patient's roles and relationships. When we consider patient's family, what are the roles and relationships of the patient? And when we consider patient's working place, what are the roles and relationships? In the patient's society, what are the roles and relationships in the society with the patient? Okay. Those are interpersonal assessment. And stresses. What kind of stresses are there with the patient? Stresses, you know what stresses, we will talk about it later. And adaptation to stress, is it necessary? Yeah, if stresses are there, there should be some kind of adaptation for stresses. Otherwise, we cannot provide any care. Purpose of assessment, why we need to assess patients? To evaluate how the patient functions individually as well as in relation to the environment and others. Especially the psychosocial assessment, how the patient functions individually and according to the environmental changes, or according to the others. We discuss about two main assessment. One is intrapersonal. Now you all know under intrapersonal what are the components, and under interpersonal assessment what are the components you need to think about. This is about intrapersonal assessment. First one is, as we discussed, self-concept. It refers to perception of self and relationship of self to others and to the patient's own life. These are the factors that influence self-concept. Developmental level of the patient. If the patient developmental level is not up to the required standards, what will happen? We cannot think about proper self-concept in the patient. Okay? So that we need to think about patient's developmental level. Whether the patient is adult one or elderly patient or child. The developmental level is important. Are there any low developmental level people among elderly people? Yes. So that is important. Sociocultural background, is it related to intrapersonal assessment? Yes. Why? Because always think according to their socio-cultural background. Even though we tell this is the importance, they will tell no, not this. According to our society, according to my experience, according to my family members' experience, the importance of this procedure or anything is this. The patient will tell like that. So that we have to identify patient's socio-cultural background. Because according to the society, they will think differently. Their experience may be different. Okay. And interpersonal relationships and roles. Interpersonal relationships and others or with others. Interpersonal relationship, sometimes we can keep interpersonal relationship among us. We think that that person is like this. So that I don't like to talk with him, or I don't like to ask what he is telling, like that. That means our interpersonal relationship to others. And health status is needed to identify self-concept. Yes. Why? How can you prove that? If the patient is unconscious, how can you give your opinion? If the patient is not in a position to understand what you are telling according to the disease condition, can you tell anything or health education regarding anything that you are doing? No. So that health status of the patient also very need. And if the patient is severe pain, he does not like to hear you, listen you. So that these factors are important when assessing patient's self-concept. These are the main components of self-concept. Other than what we have talked. And body image. What is body image? What are the instances that patients think about their body image? What are the problems that we have related to body image? It is also related to self-concept. Now, doctors are going to amputate one part of the body. Or patient is having cancer. Due to chemotherapy, they will lose their hair. Then mainly they will think about their body image. The mental picture a person has of a physical self, including its appearance and capabilities. What will happen after this surgery occurs? What will happen after this chemotherapy? Patient will think. And body schema, the mental picture that one has of one's body, that is attained from special senses. According to the patient's senses, 5 senses, any mental picture, that means before the body image they will have mental picture regarding their body image. And self-esteem, you know what is self-esteem, but here we need to assess whether is uh, it is enhanced when self-image and self-ideal are consistent. What is self-image? You know, self-ideal is comparison of the self with an ideal image or goal. Now, self-esteem is self-ideal and self-image. That means if self-image is okay, 100% okay, patient can get self-esteem. Okay. And also self-ideal means if the patient can think about the goal after this treatment, I will get this kind of body picture, the ideal picture. If he can think, or if the patient can get the real situation regarding the body image or self picture about body image, that means patient will get self-esteem. Can you all remember the self-esteem? Where is the place you learn about self-esteem? Maslow's hierarchy of needs. According to that, where is self-esteem? Under self-actualization. That means the patient has to have everything he want. And not self-actualization, but lower that. But at that level, patient is having whatever the patient thinks or he expected. Okay. Then self-image also he can, or self-esteem he can get according to the self-image and ideal image he is having related to his disease condition. Okay. You can think about it more later. And cognition, as you all tell, it refers to the patient's way of thinking and includes thought processes, memory, insight, language, vocabulary, judgment, cognition, and cognition development. With the knowledge, the patient will get development of these thinking processes and these kind of things like memory, insight, language, vocabulary. Everything get improved with the knowledge improvement. Okay. So that cognition is important to identify or important to assess when we are assessing the patient. Okay. Now, when you are assessing the patient in the wards, up to now, when you assess the patient, what you are doing is, how you assess the patient. Normally you have a list of checklist, the thing like checklist. You assess the patient about patient's background information, and physical assessment, social history, family history, social history, psychological history, treatment history, everything you take. But here at the undergraduate level you have to think about more, not just taking the patient's information. Why you need to take this? What is the importance of assessing, or what is the importance of collecting this information for your implementation? Why? What is the importance? Affect and mood, patient's verbal and non-verbal expressions of emotions. Normally the attitude related things, how we can identify with the patient's emotions and non-verbal expressions, mood, Otherwise we cannot identify. There are three commonly manifested emotions that may influence the patient's psychological functioning. They are, I told you, there are stressors, and we will talk about them later. What are the stressors? These are psychological functioning which influence the patients, what the patients are doing. Anxiety, anger and depression. There are other kind of stresses also. What is anxiety? Is it needed to knowing about anxieties? Why? What will happen with anxiety? If you are anxious, what will happen to you all? Now you are going to face for the interview, for an interview. If you are anxious, what will happen? You don't know what you are telling. If you are anxious to do any advanced nursing care, what will happen? At least the things you know well, you cannot do properly because of the anxious. Then how about the patients? If they get anxious, yes, there are lot of reasons to get anxious for the patients. Why? Not like you all. They are in an unfamiliar environment in the hospital. Unfamiliar persons, unfamiliar instruments. So that they will get lot of anxieties. So that with the anxious situation or anxiety, they cannot, in one way we cannot help him to give relief, and the other way they cannot listen what we are telling. So that thinking about anxious is very important. Assessing about anxious, whether the patient is anxious or not, because